Hello, my name is Trevor Sanderson, and this is my presentation on Duchenne muscular dystrophy. To start, Duchenne muscular dystrophy is also referred to as DMD. It is an inherited X-linked recessive gene disease caused by a defective gene for dystrophin. Dystrophin is an important protein that is primarily found in skeletal and cardiac muscles. However, it can also be found in some nerve cells located in the brain. Its role is to stabilize muscle fibers during muscle contraction as well as muscle relaxation. Dystrophin is crucial for muscular stability and structure and protects them from injury. However, if dystrophin is not present, then this leaves muscle fibers extremely vulnerable to injury and weakness. DMD is most common in males, but can occur in females as well, but is very rare. As we learned earlier in the semester, males only have one X chromosome, while females have two X chromosomes. As a result, if a mutated gene is present on the X chromosome in males, then it has a 100% chance of that mutation/recessive gene of being expressed. However, since females have two X-linked chromosomes, even if one of the X chromosomes has a mutated recessive gene, but the second one does not, then the dominant gene will be expressed as in order for the recessive gene to be expressed in females. As a result, although DMD can be diagnosed in females, it is very rare to the fact that females have two X chromosomes. DMD is a progressive disease, which means that the onset of symptoms occurs gradually over time as opposed to all at once. Now for the physiology of DMD and dystrophin. Dystrophin is an important bridge or link that connects the muscle cell's cytoskeleton or internal framework to be extracellular matrix and then stabilize the sarcolemma. The sarcolemma is important because it is the cell membrane that surrounds the muscle fiber. Individuals who have DMD do not have this protection and stabilization for the structural integrity of the muscle fibers. And as a result, when muscle contractions occur, the sarcolemma is damaged and tears. When these injuries occur, an abundance of calcium ions enter the cell and damage the fibers responsibly for contraction. Now that the muscle fibers are damaged, an inflammatory response occurs among the surrounding connective tissue due to the damage that has occurred and the absence of dystrophin. The regeneration process needed to repair muscle cells and fibers is significantly delayed and is ultimately lost completely. As a result, severe muscle weakness and wasting. My second bullet shows the physiological process of DMD. Here is a microscopic picture of a healthy muscle cell compared to the damaged muscle cell of an individual with DMD. The healthy cell is a picture on the left, and the damaged cell as a result of DMD is on the right. The damaged cell has more fatty tissue as well as fibrotic tissue. This is because as a muscle cell dies, it is ultimately replaced with fat cells and connective tissue within the muscle. The build of fat and connective tissue contributes to muscle weakness seen with DMD because it distributes the typical makeup and interactions of muscle fibers because it is taking over the space that the regenerated healthy muscle cells would have been located if the person did not have DMD. Also, the increased amount of connective tissue can make the muscle fibers to become stiff, which can negatively impact the strength of muscle contractions as well as the flexibility of muscles. DMD impacts a person's anatomy in multiple ways. Muscular, results in weakness and atrophy. You will also see calf muscles hypertrophy, which presents as enlarged calf muscles and is a result of the buildup of fat and connective tissues, which we discussed previously. Skeletal, DMD has been linked to the thinning of bones. Spinal, DMD has been linked to cause scoliosis. Cardiac, DMD has been linked to cause the heart to become enlarged, resulting in dilated cardiomyopathy. Respiratory, DMD has been linked to the weakening of the muscles that make up the diaphragm, which leads to breathing difficulties, respiratory infections, and even difficulty swallowing. Please pause to read the following clinical presentation scenario for DMD. The onset of symptoms typically begin around 2 to 5 years of age. To diagnose DMD, a doctor may complete a physical exam, complete blood tests, genetic testing, or complete muscle biopsy. In blood tests, high levels of creatine kinase is linked to DMD. Creatine kinase is an enzyme that is released in the blood when a muscle is damaged, and as we know, DMD causes high levels of damage to muscles. Muscle biopsy is done to look for signs of DMD at the microscopic level, which could include buildup of fat and connective tissue, muscle cell death, and splitting of muscle fibers. It is important to note that all treatment options for DMD are not to cure the disease, as it is progressive and irreversible, but treatment options for DMD are to work to slow the rate of progression of the disease. Here are some of the treatment options that are used for this process, which includes anything from physical therapy to gene therapy. DMD is a fatal disease. The life expectancy is from late 20s to early mid-30s. The progression of DMD has been broken up into stages based on the phase an individual is in their lifespan. The following bullets list out DMD's progression. Please pause to read. Here is the continuation of the progression of DMD. Please pause to read. Here are my references. Thanks for listening.